return demonstration to save yourself the grief. Okay, I've got that marked. That'll be hanging out of her nose. That should not be too much of an irritant.
Okay.
All right.
Now you're going to need to lubricate.
All right. Now, we've already verbalized that on a human you would use some Surgilube, but on our mannequin, we can't use that. So I spray a little bit of this stuff into the emesis basin, mannequin lube, and I'm going to run it around in here. Okay, I'll leave that sit there. All right.
Okay, so now you want to tell the patient to extend the neck back against the pillow and begin to insert the tube, but at the same time you're going to have her hold her cup.
Right. I'm going to grab a straw. Solid over here. Oh, it's taped to the cup. How cool is that? Okay, somebody was thinking. All right, Maritza, we've got what you need here in terms of your cup and straw. Just to simulate what she's doing with this, I'm going to set it here. She would hold that and begin to sip when the time is right. And setting the pillow below the shoulders and below where the neck bends back allows the patient to comfortably tilt their head back. So that's why this went down a little lower when we first got started. Okay, now I do want to warn the patient, Maritza, you're a nurse, you know this, but I'm going to tell you anyway. This is going to pass into the area that would cause a gag reflex.
Oh my God.
I know. But what you're going to do is continue to sip.
Oh.
All right, and that will help it to go where it needs to go.
All right.
All right, shall we go?
There goes nothing.
All right, I'm going to go back and it's going to feel like I'm going towards your ear on this side. Okay, it's time for you to pull your head forward and continue to sip. Oops, there goes the cup. All right, you're doing great. And students, you want to be sure that this isn't curling up inside their mouth, which can happen at times. And it is not. All right, we're in, Maritza. We're in.
Oh my
You're
goodness.
a champ. Let me give you another little sip. Go ahead and drink that, because we'll draw it right back out with our suction in a second. There you go. Oh, yeah. All right, let me give you a tissue, too, so that you can reach up and dab at your nose if you like. Yeah, you're a champ.
You're a great nurse.
Aw, thank you. All right, so now I'm going to take the tape that I have prepared and just use it to gently, if it were on the table or the bed, it wouldn't be trying to come off the cup. I'm not really gonna super secure this right now. I'm just gonna use it to secure it while I check my placement.
And what was the rationale of not super securing it?
Because I may need to move it. I may need to advance it.
Okay.
So at this point, I believe I'm where I should be because I've moved it up to that area where the thing is on the tape is on the tube. But just in case,
Okay.
I'm not going to secure it till I'm confident it's where I want it.
So now you're going to inject your air?
So now, I'm going to raise this up here. We've relieved pressure in her abdomen. If I have this down low, the contents of her abdomen are going to gush. So I'm bringing this up here, drawing up 20 cc's of air.
30.
30.
And, you know, maybe
30
for the
cc's.
students, maybe they could already have the air ready
Yeah.
to go before.
I should have.
No.
I should have.
But again, it's just something that, you know, they don't have to do it exactly how we've done it.
Exactly. So, I'm going to inject air while I auscultate.
Okay.
So, you want to be auscultating on skin. I'm going to put your stethoscope in the right way. I said that like I was talking to kids. All right, I'm going to do this on skin under the gown. Maritza, this might feel a little cold, but I'm going to be listening for air to swoosh. All right, 1, 2, 3. There we are. All right, I got a nice sound there.
I'm so glad it's in.
It is in. Now to confirm that, yet again, this is the best means. Not everybody does it this way, but I've drawn up some contents from your belly. I'm going to squirt it into my emesis basin here. And then I'm going to check it with my litmus paper, testing the pH. Oh yeah. That's about 4 to 5. The color indicates that it's acidic. Therefore, I'm pretty confident I'm in the right place.
Okay.
So at this time, I'm going to attach this suction. There's not a connector here, so I'm going to use the one that came with it. And we're going to apply we're going to apply medium suction is what I meant to say. 80 to 120. Usually with Salem Sump, you're going to apply continuous. But now I'm sure this is where I want to be, so I'm going to go ahead and secure this. Maritza, this tape may become uncomfortable, but it helps us to be able to judge whether or not this tube is moving around. So, okay. Let me get you a little more comfortable. How do you feel?
You know, I feel like I'm getting a lot of pressure relieved in my belly.
Good, that was the objective. I should have mentioned that from the start.
No, that's
I think
okay.
I
I'm
did
glad
say
to know that that was an outcome expected.
That was an expected outcome. We wanted to, we call it decompress, and I may have said that word to you if you didn't know what I meant.
Yeah,
That's
I did
what
hear
that is.
that, yeah.
Yeah, that's what I was talking about. So, at this time, I'm noticing that you've got some brownish liquid coming out. Looks like about 200 cc's already.
Yeah,
so you've
wow.
got
I
to
am
be
just
feeling
like,
better
ooh,
already.
I could go run around the block now.
You better rest. But I will go make a note about how you've tolerated this, etc. You know, the contents of your
Excuse
stomach.
me, you still have to tape.
Oh,
That's
thank you for reminding me. And around the pin, so that you have some latitude in turning toward the door or toward the TV or whatever it is that you'd like to do. I'm just going to adjust your tape real quick.
And how long will I have this?
Well, that will be up to the doctor. Before we ever got started, you remember earlier today I was listening to your belly and things were kind of quiet and distended. They're going to be watching for you possibly to move your bowels. They're going to watch how much is coming out of your NG tube. They're going to keep an eye on you. All the nurses that come after me will keep an eye on you. We'll not watch for that distension to go down, listening for bowel sounds. So there are a lot of indicators that show that you're improving. So we'll keep an eye on those things.
Okay, thank you so much.
Great. All right, so we've got your tube in place. We're going to keep the vent above the level of your belly, so it's kind of tucked up here behind your pillow. Suction is on. I'm going to clean up my things here. Feel free to take a nap while I get cleaned up here.
I am kind of tired, thank you.
All right. Okay, then time passes. I've assessed the bowel sounds. The doctor has read our reports. And it's time for this tube to come out.
And how would you assess the bowel sounds with someone who's getting decompressed?
You would have to turn off the suction, which is key, because someone who has absent bowel sounds may sound like they have bowel sounds while suction's coming through. Good question.